Nigeria's doctors are leaving. They're heading abroad in huge numbers. In 2021, the World Health Organization recorded Nigeria had just 4 doctors for every 10,000 people, an already dire situation. But since then, things have worsened rapidly, and Nigerian Medical Association now says there's only 1 doctor per 10,000 people, and that's left hospitals desperately short of staff. I'll speak to one doctor who migrated to the UK in a moment, but first, here's DW's Flourish Ubanyi, who sent this report from Lagos.
Getting medical care in Nigeria can be frustrating for everyone. Kenneth Udofia is doing the job he dreamed of. But 2 years after qualifying, his thoughts are abroad, where he hopes things will be better.
When you see the standard of life you are having, you cannot equally comfort yourself. Yes, fine, at least I know I'm actually working, I'm giving out to the society, but the society actually appreciates my effort and are paying me back. I'm being rewarded.
The feeling that many medical professionals have of being overworked and under-rewarded is one of the things driving them to leave in large numbers. They say they want a system that not only pays them well, but also provides the right equipment. Esosa comes from a family of nurses and doctors. Many of them live and work abroad, and she's planning to leave too.
I heard Australia pay very well. I think Australia and US, somebody was saying something like that, but I don't know.
Crowding gets worse as health professionals leave, yet most people seem to understand why they go.
I wouldn't blame the healthcare people also. We are all dissatisfied. Even no matter where we are working, we are all feeling bad. And if you are not okay personally, I wonder what service you want to render to other people.
For me, I'm a pharmacist. And yes, and getting to attend to so many patients at the time is not cool at all. You don't really give your best, so you just try to do as much as you can. But at the end of the day, it's not efficient. It's not enough.
If you are given an enabling environment to practice, nobody wants to leave the shores of this country to travel abroad.
Even people that are not doctors, they're leaving the country. It's as if we don't have hope.
Hope is hard to come by, even in private hospitals like this. They simply can't keep their staff. Dr. Tunde Oyedeji runs this hospital. He's 63 and says he'd like to work less, but that a lack of staff means his days remain long.
It has been very, very tough getting health personnel, both the nurses and the doctors. And even when you get them, when you train them for a few months, they are gone.
He says the future looks bleak for young medics in Nigeria.
I can't even say they should come and stay here. It's better for them to go out because of the situation of the country. But that should not be the case.
That even applies to 2 of his own children who are doctors, but rather than taking over from him, are working in Europe.
I'm now joined by Dr. Oyinkansola Femi Oyewole, a YouTube influencer and a medical doctor based in the UK. Thanks for joining us on DW News Africa. Now, can you tell us, why did you decide to relocate from Nigeria to the UK?
I was basically just looking for greener pastures because I believe that practicing medicine in Nigeria was just getting a bit more hostile, and I just wanted to be able to thrive. So that was the reason I decided to make the move.
And we've heard stories from doctors in Nigeria talking about long working hours, poor pay, poor working conditions, some saying they even feel exploited. Is this something you recognize?
For sure, 100%. Practicing medicine in Nigeria felt like we were pouring our hearts into it and we weren't really getting anything back in terms of remuneration or even recognition, or basically just quality of life. The effort wasn't equal to the output we were getting in return, and that was just definitely a major factor for me with deciding to move.
And what's been your experience in the UK? Have you found what you were looking for there?
For sure, things are significantly better here, but like they say, the grass isn't always green on the other side. Coming to the UK has its own problems, but when you compare the pros and cons with Nigeria, then this is significantly better than Nigeria. For one, I don't have to worry about my salary being paid because I know that at the end of every month, I'm going to get my salary as long as I work. As opposed to Nigeria, I was owed a 6-month salary at a stretch with no one caring how you're going to feed your family for the 6 months, and you're still supposed to show up at work and smile and be happy while being hungry. And I know that that's not something I'm going to deal with in the UK. So that alone is already worlds apart.
And that trend is still going on. People like yourself still leaving Nigeria and heading abroad. But what would it take for someone like yourself who's made this big move to go back to Nigeria? What would convince you to make the move back?
If I'm 1,000% sure that when I work, I'm going to get paid as at when due. And if I'm 1,000% sure that my salary is going to be a decent salary that's going to afford me a decent life, and I'm also 1,000% sure that my life and my family's life and security isn't going to be jeopardized, then I'm more than happy to move back home. Because recently there was a story of a girl in the news who was a medical doctor who died because of negligence. She fell down a flight from the escalator that wasn't working, and she died. And that wouldn't typically happen in developed worlds. So those are the things that I refer to when I say that my life and the life of my family isn't at risk, because Nigeria has its way of doing things suboptimally, and it just puts everybody else at risk.
You talk about Nigeria as a whole, and you even talk about 1,000% needing to be convinced. So that shows that you still have a lot of doubt. What's it looking like, not just for doctors, but even for other people in other professions? Do you see other people making similar moves like yourself?
Yeah, I have a friend who just moved to Canada like 2 weeks ago, and she's not even a doctor, she's a lawyer, and she was doing pretty well in Nigeria. But then again, you have to look at the whole picture. So it's not just about money, it's also about security. And we're not just talking about Boko Haram in terms of like terrorism, we're talking about day-to-day security, which is something that is seriously lagging in Nigeria. That's why a lot of people, there's a Japa movement at the moment, and everyone's looking to move out of the country. These are the factors that influence that decision, basically.
All right. It's good to hear your thoughts on this. Very good to speak to you, Dr. Oyinkansola Femi Oyewale. Thanks for your time.
Thank you, Tim.